Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. First, some of the highlights. Today, National Association of Resident Doctors of Nigeria, NARD, embarks on nationwide strike starting today as country grapples with COVID-19 pandemic. Nigeria records more COVID-19 infections across 35 states and the FCT as total samples tested nears 100,000. And coronavirus lockdown eases in France as shops in England selling non-essential items open for the first time in almost 3 months. Gombe State, for the first time, has recorded the highest number of COVID-19 cases in the country, with 73 infections out of the 403 announced yesterday by the Nigeria Center for Disease Control, NCDC. This brings the confirmed cases nationwide to 16,085, but it's also more recoveries from last week's number, now put at 5,220 patients discharged, and the death toll at 420. Of the 403 new cases, Lagos comes after Gombe with 68 cases, Kano 46, Edo State 36, the Federal Capital Territory 35, Nasarawa 31, Kaduna 17, Oyo 16, Abia 15 cases, Delta and Borno States 13 cases each, Plateau 8, Niger and Rivers 7 each, Enugu and Ogun State 6 each, Kebbi 3, 1 each in Ondo, Anambra and Imo State. Here's a breakdown by region showing Lagos State in the southwest, the highest in the country at 7,103. The north central, the FCT, 1,247. Kano topping in the northwest with 1,137. Edo leading in the south-south with 580 cases. Borno tops in the northeast with 438 cases, and Abia overtakes what used to be Ebonyi in the southeast with 166 cases. Now, the National Association of Resident Doctors of Nigeria, NARD, appears to have made good its threat to withdraw its services as members embark on an indefinite nationwide strike beginning from today. The national president of NARD, Dr. Ali Sokumba, announced the commencement of the strike at a press conference in Abuja today. It comes after their warning last week that the doctors were taking what they described as a painful decision following the inability of the government to meet their demands. All resident doctors, medical officers below the rank of principal medical officer, and house officers across all the federal and state hospitals in Nigeria are expected to join the action. The association has asked the government to make alternative arrangements for the care of patients, including those at the COVID-19 isolation centers, who are to join the industrial action in 2 weeks' time. Some of the demands of the association include provision of adequate PPEs for all healthcare workers, the immediate reversal of the disengagement of all 26 resident doctors in Jos University Teaching Hospital, the universal implementation of the Medical Residency Training Act in all federal and state hospitals, ensuring pay parity among doctors of equal cadre, implementation of the revised hazard and payment of agreed COVID-19 inducement allowances, the stoppage and immediate refund of all cuts in salaries by members of Kaduna and other state governments. Now, Dr. Julian Ojebo is the first vice president of the National Association of Resident Doctors of Nigeria, NARD, and he joins us from our Abuja studios. Welcome to the program. Now, your association begins a nationwide strike today. How many doctors are we looking at downing tools? We understand the doctors in isolation centers have been exempted.
Good morning, Millicent, and thank you very much for having me. It's no longer news that the Nigerian Association of Resident Doctors have embarked on a total and indefinite industrial action. This stemmed from the result of the federal government not being sensitive to the plight of Nigerian doctors. Most governors of the state governors not being responsible, as it were, to the needs of the doctors that are laying down their lives at this time of the pandemic to make sure that Nigerians are safe and secured. We commenced our strike sometime between the hours of 12:01 a.m. this morning, and for the past 12 hours we've been on strike. But for the intervention of the Honorable Speaker of the House of Representatives, Right Honorable Baja Biamila, and Dr. Tanko Sununu, and also for well wishes for Nigerians, we decided that we should, at this interim time, exempt our workers, our doctors that are at the various treatment and isolation centers, so that they can take care of Nigerians at this very time. While we do that, we still expect that government, within this first 2 weeks, while we've given that grace period, will look into the yearnings of the Nigerian doctors and bring a stop. Should this continue after 2 weeks, we'll have no other choice but to make sure that we'll retrieve or withdraw all our members from those isolation and treatment centers.
Can you give us a figure as to the number of doctors that are downing tools nationwide?
The total population of our membership spans over 16,000 Nigerian doctors. That's a very large number, but at this time, we have decided as a National Executive Council to allow some of our members that are in the treatment centers. So we have all the treatment centers properly covered at this very time of the pandemic. So the other doctors have been mandated to go back to their various homes while we continue negotiations with the federal government.
So, Dr. Ojebo, what has the government said so far? Because you listed a number of things, like the provision of adequate PPEs, the revised hazard and COVID-19 inducement allowances. What has government said so far?
About the time the strike ultimatum was given, the Right Honorable Femi Baja Biamila called for a stakeholder meeting. At that meeting, we also did mention to them that some of our members have been, their jobs have been terminated at the Jos University Teaching Hospital. We also did decry the non-implementation of the residency training funding in the revised budget. As we speak now, they have put the residency training funding in the revised budget, but we also know that that does not amount to disbursement of funds to the recipient. So at this time, they have recalled all 26 doctors. They've also done the residency training funding. Appropriation has been done for that purpose. What we don't have yet at this time is the monetary backing for all of these promises that they've given so far. So at this time, we currently have a meeting ongoing with the National Assembly. We are hoping that in no time, all these our demands will be met. But at this very time, we do not have any concrete thing on the table. All we have at this moment are just promises and promises. So we're hoping that these promises will materialize into what we actually want at this very time.
Finally, Dr. Ojebo, would you say that government is prioritizing, especially as we are fighting a pandemic here in Nigeria? Dr. Ojebo, if I might repeat that question, I just wanted to ask, how much would you say government is prioritizing, seeing as, doctors are going on strike and then seeing as that we're battling a pandemic?
There is insensitivity of members of the government at this very time. We must say that. Looking at our state tertiary health institutions, let me reveal something very shocking. Like a state like Imo State, doctors in Imo State, since the coming to power of Senator Hope Uzodinma, our members in Imo State have not been paid a penny as salaries since March 2020. How do you want to motivate these patients or these doctors to work for the populace called Nigeria when they've not been paid? So we really do want government to put its mouth where it truly should be at this time. At this very time, all we have are just mere promises. There's nothing tangible on the table at this very time. So should we see something tangible, we'll be reconvening our National Executive Council to discuss the way out further. But at this very time, there's nothing concrete on the table, and we are hoping that the government, the executive arm, will appealing to the president to come out and use his goodwill and address the yearnings of the Nigerian doctors.
We'd like to thank you, Dr. Julian Ojebo, the first Vice President of the National Association of Resident Doctors of Nigeria, NAD. Thank you for joining us on the program.
Thank you very much.
Over in Lagos, the state government has kick-started the physical verification and issuance of safety compliance certificates to social clubs and centres in the state. Speaking on the exercise, the Director General, Lagos State Safety Commission, Mr. Larry Mujola, commended the level of compliance with stipulated safety guidelines, while most of the clubs visited, adding that it is vital to ensure that all issued directives, especially on physical distancing and proper hygiene, are fully embraced by these facilities. According to him, the Commission has started issuing provisional safety compliance certificates to some social clubs that have registered and had their locations verified, urging business owners who are yet to comply to do so. The Director General, however, sounded a note of warning that centres whose registration and verification have not been completed are not allowed to open until an announcement is made by the Lagos State Governor effective for opening social centres. The European Union Managing Conflict in the northeast Nigeria under the British Council-supported programme has donated COVID-19 personal protective equipment, PPEs, to Sexual Assault Referral Centre in Damaturu. Making the presentation, the state team leader in Yobe State, represented by the state programme officer, says the effort is to support and enhance service delivery of the health workers.
Because of the nature of their work, at this period of COVID-19, it shows that they may come in contact with patients who are carriers of the COVID-19 virus. So we are making the presentation to enhance their work and to protect the staff who are taking care of the patients.
We are sincerely grateful for this presentation of personal protective equipment made. If we remember way back, the World Health Organization has declared the COVID-19 as a public health emergency of international concern. So we know that this will go a long way to provide some form of protection to us and also to the survivors and the people that are patronizing this center.
Still to come on the program, we have more on compliance ease across the country. To join us again. Welcome back to the program. We have Dr. Olugbenga Koka, a clinical psychologist, Lifecrest Medical Services. He joins us here in Lagos. Welcome to the program.
Thank you very much for having me.
All right, let's look at compliance. Lockdown ease is taking place across the world. So far, Nigeria, we're still getting an increase in the number of cases, yes, but we're expected to comply with the safety measures.
Yes.
But we're seeing a lot of people who are not complying, from Abuja to Lagos to name it. Why do you think this is happening?
Okay, it becomes very important at this particular point in time to understand the mindset of people, as in human beings generally, and how we reason. And one of the things that is happening is that whenever events that is out of the control of an individual happens, one of the things we scramble with is to regain control. So at this particular point in time, one of the reasons that is preventing individuals from actually complying certain categories of individual, or majority from complying, is actually the issue with control. When I perceive that you have taken all the control away from me, then it becomes a problem because I feel naked, I feel vulnerable, I feel like I'm not in charge of my life, I feel I've taken everything away, I feel, that's why people there, yes. And so I try to do what is in my best interest. You call it a reaction, but for them, nobody actually deliberately wants to hurt himself or herself. What they are just trying to do is what they perceive or they see to be in their own best interest. So that is one of the reasons why we have issues with control or compliance today, issues of control. So another reason why we have that is that most of the time there's something we call opposition defiance disorder, ODD. So in certain particular type of individuals, it's not yet a disorder, but the defiance is there. So how do I prove that I'm in charge of myself if I don't go against what you, especially leadership and authority? So that is what they are usually in loggerheads with. So if I don't prove that, no, I can actually do this my own way and still get my results regardless of what you think. So for those kind of persons, and this, the environment we live in, the older one models certain things for the younger one to see. So over a period of time, it is entrenched from generation to generation that it is fine to just defy certain rules and regulations like that.
So are you saying that some of the people who believe that COVID-19 is not real, is a disease for the elite? Is there something wrong with them?
That falls in the third category, which is the people that, one, they are not in the circle of those persons that have been the victims that have been affected in one way or another, or they don't even know, they have not seen, neither them, their family, or persons around them that do not know.
We'll come back to some of those explanations. I understand we have Professor Maurice Iwu, a professor of pharmacognosy, chairman of the Imo State's Task Force on COVID-19. He joins us via Skype from Owerri. Welcome to the program, Professor. Looking at Imo State and the number of confirmed cases, those that have been discharged, a lot of people would like to know how much testing is ongoing in the state and about compliance levels as well.
We did predict that earlier on there were lower number of testing, and secondly, we are now in the phase, more dangerous phase, where we are having a community transmission. And then that also makes the point about the compliance. People tend to be complacent when they think, as you rightly pointed out, that they have not seen anybody close to them that died, and that's why we are heightening, making some of the issues now more public, so that people will know that this is real, that there are some individuals that are dead and those who are also sick. That's one of the things we are doing. And much more importantly now, the cases that we're having confirmed cases, sooner or later they go into symptoms. Before they were totally asymptomatic. Most of them have no symptom, but now we have people who are sick. But the more dangerous one is that a lot of people are scared of going into isolation. So they self-medicate, self-treat, and we are trying to discourage the private health centers from taking those patients, because we're also worried about the high level of health workers' infection. They are really in a very serious dilemma here. They will need to help the patients. Yes,
you mentioned health workers, because we heard from the first vice president of NARD, the National Association of Doctors, saying that Imo State doctors, resident doctors, have not been paid since March.
Yeah, one of the things we also try to separate here is that we are trying not to interfere with the issue of governance. We know that we need government support, but the task force is trying to concentrate with the issue at hand. There was some administrative lacuna in terms of what they were doing, in terms of the system of payment this government has introduced, which is electronic payment. And some agencies of government have not complied with that. That is totally outside our control. But that we have also made representation on their behalf to government to say, look, while you're sorting out your issues that these doctors need to be paid, whoever is in contravention, you can then deal with that later. And I think by today, they have actually done that. But that's totally outside the mandate that we have. Our mandate is to help advise on the best method to cope with the pandemic. We are not involved in any way with the normal government administration. From a strategic point of view, we also made it clear that we shouldn't be involved in the administrative purchasing and buying things and supplies and so on, so that we will be able to have a cooler head. I know it is an elitist view, but we chose that path so that we can advise government without the saddled issue of administration in terms of who gets paid and who doesn't get paid and who get paid. Those things are very essential. I'm not saying they're not essential, but we have to divide our own task. Our own task is that of devising method and decoding some of the scientific facts that are coming out from WHO and CDC so that we domesticate them and be able to make what is the best interest of the state. And I also serve in the neighboring state committee, that's Anambra. And that is the issue that we are, again, allowing the Ministry of Health do what is their job, the Ministry of Transport do their job, the police do their job, so that ours will be the kind of coordination. We noted that issue, and we are working with the resident doctors since the last week when we got to know about it. And by today, I think the matter was actually settled. But I think there's a national strike that is going on, which is not directly impacting on our work, in the sense that ours is to be able to advise and say this is the best way to do the work.
I must quickly ask you, Professor, just before we let you go, and that is on your solution to COVID-19. I know you announced that there was possible treatment. What's the latest on that in 40 seconds?
Yeah, we're making progress, significant progress. As you know, we told the government that this disease was treatable, curable as far back as February 4th. So what we did adopt a dual track mechanism. We have a product that's registered with NAFDAC called IHP Detox Tea. While we have that already in the market in pharmacy shops as a prophylactic and also treatment-wise, but we're also developing full-scale standard pharmaceutical ingredient, which is going through clinical trials. We have assembled, or we have a group of doctors assembled themselves, so to speak, and they are subjecting it to clinical trial. It has gone through NREC registration, it has gone through Pan-African registration, it has also done dotting all the I's and crossing all the T's. So it's going to be done in the global best practice, so that we are proceeding with that.
We appreciate your time, Professor Maurice Sibu, Professor of Pharmacognosy, Chairman, the Imo State Task Force on COVID-19. Thank you for joining us.
Thank you, ma'am.
All right, finally to you, Dr. Coker, on compliance and what you think people should do, seeing as the government is trying to tell people to take all the necessary precautions to protect themselves as we're seeing more numbers.
Okay. One of the things we have to do is this, for certain individuals to, especially people at the grassroots, to come to the understanding of what we are really talking about. Television is far from them. Radio is far. They have to do community mobilization. The head of groups, clans, families has to be individually educated. Put them together in the form of society, in the form of streets, in the form of communities like that, and talk to them. Let them feel your pulse. Let them feel your breath like that. Then they understand what you are talking about. They take it back home, not what they see on TV. See, some people cannot distinguish between Nollywood, Hollywood, and what you're actually talking about. But when you get to them, family basis, community basis, they are able to understand that when the woman goes to the market, some form of psychoeducation is going on there. When the man is in the house, on the street, there's form of education going on there. When the children that are not at work are at home, there's a form of education going on around.
We'll definitely have you come again on the program.
Thank you very
we
much.
appreciate your time. Dr. Lugbenga Coker, clinical psychologist, Life Crest Medical Services. Thank you for joining us.
Thank you very much for having me.
Coronavirus lockdown is easing across Europe. Non-essential shops are opening in England as France reopens cafes, restaurants and borders. This is coming as global coronavirus figures inch towards the 8 million mark, standing at over 7,930,000 cases. The death toll is more than 433,000, but thankfully over 3.7 million people have recovered. And from the NCDC, while they work to provide Nigerians with verified information on infectious diseases, their team continues to monitor misinformation. The website has all the details, also regular updates on the COVID-19 regulations. It's the same with the World Health Organization. You'll find the interactive map with the latest cases and also strategies and plans on the virus. Our website, channelstv.com, has the latest news. All you need to do is log on, www.channelstv.com. That's the COVID-19 update. Thank you for watching. I'm Millicent Nwaka. Bye for now.